Hello, everyone. My name is Andrew Schroeder. I am the Vice President for Research and Analysis at Direct Relief, and I'm happy to invite you all to this discussion around the implementation of real-time disaster risk models. This is some work that grew out of collaboration in two cases in what now seems to be the long ago world of 2019. The cyclones which struck Mozambique and then the hurricane in the Bahamas, both of which were enormous events which involved a pretty broad range of collaboration around information management and modeling, and which became the basis for a series of discussions which had played out and projects which had played out across this year, focused on how we might do a much better job with bringing modeling of various kinds, ranging from epidemiology to population mobility, evacuation, physical risk, and other types of dynamics into the response frame itself, where it's been peculiarly difficult to deal with this kind of work. And I think that's true for a lot of reasons that the folks will go over in a second, and I'll introduce them in 1 minute. But there's several different parts to this discussion, I think. So one aspect is around data in particular. So we've had long-standing challenges in information management and data collection in the health sector alone around disease case reporting, the formats with which we receive data in terms of disease, access to baseline data, health facility locations, health facility reporting, you name it. Logistics data has been challenging for a variety of reasons, just to do, kind of monitoring and, appropriate accountability during emergencies, let alone to incorporate predictive information, predictive modeling, predictive analysis into how we respond. But that's really been true, I think, across the board. A group of us during the response to the cyclones in Mozambique began working particularly around response to the cholera epidemics, with the question in mind being, how could we, given that there's a long-standing set of models for cholera prediction, for looking at transmission rates and the movement of the disease through populations, is that something which can be brought directly into things like vaccination program planning as it's played out? And Rebecca Kahn will be talking about this from Harvard School of Public Health. We'll be talking about the work that was done to make some of that work, at least in the initial stages, and then looking at where we can go from there. Similarly, Erin Huey from the Pacific Disaster Center, which works really globally on a broad spectrum of emergencies, will be looking at work in broad spectrum risk models for how we can understand some of these dynamics in hurricanes and other disaster risks across the world. And then Facebook Data for Good really, in many ways, brings a lot of us together, where the data that's provided by Facebook, particularly population mobility, looking at digital signals for how populations move, and population density, looking at disaggregation of population densities, and other data sets that are collected at scale in real time, large scale mobility signals in particular, will be discussed through Alex Pompey's work in the Data for Good program. And you'll really see that this is a thread that runs throughout all of our work in many ways. So we should have about 15 to 20 minutes for discussion at the end, in which case I'd also like to bring in my colleague, Nick Jones from GFDRR, to talk about some early work around integration of mobility data into risk modeling from the World Bank's point of view as well. I should note as well that we're, we've brought some of this some of these projects together in a new initiative called Crisis Ready, which I can put the URL in the chat, where you can find it at crisisready.io, where we're thinking through the best ways to bring together both the data readiness, methods readiness, and the translational networks, translational readiness required to implement these kinds of collaborations across different partners. So hopefully this is a pretty rich discussion, and we can help to move forward some of this work in collaboration with many of you. So I would like to turn it over then to my colleague, Rebecca Kahn. I think I have to stop sharing and get things going with the Mozambique case. Rebecca?
Great, thank you so much, Andrew. Just share my screen. All right, so thanks so much, Andrew, and thanks to everyone for having me here. I will be speaking about the work we did on rapid forecasting of cholera risk in Mozambique, translational challenges and opportunities. So as Andrew mentioned, in spring of 2019, Mozambique was hit with 2 back-to-back cyclones. And you can see from the pictures on the right some of the devastation that occurred. The first cyclone hit the middle of the country, and the second cyclone just a few weeks later hit the northeast of the country. And by early May, the World Health Organization had reported that more than 250,000 people were affected and more than 45,000 homes destroyed. There was massive destruction and displacement of people. And from these cyclones and the damage that they caused, water, sanitation, and healthcare systems were all damaged. And so this leads to increased risk of outbreaks, and particularly increased risk of cholera outbreaks in areas where cholera is endemic, like in Mozambique. And in fact, following each of these cyclones, cholera outbreaks occurred. So as Andrew mentioned, the question was kind of, given the limited resources, where to prioritize cholera vaccines. The goal was to get cholera vaccines to as many people as possible, as quickly as possible, but there were limited resources, so some prioritization had to be done in determining where the best places to start these vaccination programs were. So in between the 2 cyclones, after the first one and before Cyclone Kenneth hit, we formed some partnerships. Kind of this ad hoc team was created, and this figure kind of shows the organizational structure reflecting our team. So on the right here, we had a team of academics. So I'm based at Harvard, and we had a few people who were working on this. And I'll talk about this a little bit more in a minute, but we worked with some folks at Hopkins who have done a lot of research on cholera and have a lot of cholera data that was really helpful to us. We had a team member that worked at Northwestern and also at NetHope, kind of bridging the gap between our non-governmental organizations and academia. And we had folks from Direct Relief. So these organizations were, working on the ground, trying to set up these vaccination programs and figure out, working with the government to help prioritize vaccination. And then really importantly, we had colleagues from the public sector, from the World Health Organization and the Ministry of Health. So we had these 3 buckets of public sector, NGOs, and academia, and we were all working together to attempt to figure out how to best respond, how to prioritize, given a short time frame and limited resources. And throughout the weeks that we were working on this, we had constant communication back and forth between all three areas of our team structure, and this allowed for inputs of available data, thinking through kind of what the considerations the government was facing were, and also trying to get as much data as we could to inform this response in a meaningful way, and then communicate it in a way that could be useful. So we decided to develop just a simple model to try to figure out which areas were most at risk and where vaccines should be prioritized. So we created a model for cholera outbreak risk based on 4 measures. So the first measure we included was a gravity model simulating human mobility. So gravity models take into account the populations in each location and the distance between them, And we're trying to think about where people would be moving from the areas that already had existing cholera outbreaks. And for this, for population data, we use Facebook data for goods data. The second piece of information we included was the flooding risk index. For the first cyclone, we had measured flooding data for where floods actually occurred. And at the time we were developing this model, we had projected flooding data for the second cyclone. So these two sources of data were kind of new sources of data based on the existing situation following the cyclones. And then we also wanted to incorporate more static risk factors. So thinking about which areas had had large cholera outbreaks before and what was the estimated incidence of cholera. So this is where we relied on colleagues from Hopkins. You can see this paper from Justin Lessler et al. That looks at the annual incidence of cholera per 100,000 people. So we used these data as a way of thinking through kind of baseline risk for cholera in the absence of cyclones. And then we also used some data from this paper from Moore et al. Looking at the sensitivity of previous cholera outbreaks to El Nino. So thinking about in the past, how sensitive have areas been to changes in weather and to severe weather events. So we picked these 4 metrics because we thought that they were important for thinking through the epidemiology of how cholera spreads. And it was also data that were available to us at the time that we could implement in our model quickly. So we created a web-based tool that allowed users to examine the intersection of these factors. And the tool is you can pick which of these 4 metrics you want to include in the risk score. And of the ones that are selected on the website, we chose to weight the risk factors equally because we thought that was the most straightforward in terms of communicating how the risk scores were generated. And we also didn't have any strong evidence to suggest a more complicated weighting scheme. So this is an example map. And so here's Mozambique, and in the top right, the dotted circles and the solid line are showing the projected flood path for Cyclone Kenneth, the second cyclone. And so we were thinking about kind of which metrics to include in the model that we thought was most likely to predict the highest areas of risk. We chose to include 3 of our 4 metrics. So previous cholera incidents, the projected flooding from Kenneth, and then the El Nino sensitivity score. And on the map, we show, we normalized the risk scores to be from 0 to 1. So the darker the colors, the higher the risk of the different areas. And then in the web-based tool, we also produced a table that ranked the highest risk areas. So our unit of analysis was district, and we also had the populations of the different districts listed. And I just highlight 2 districts here that were in our top 5 of the projected highest risk for cholera outbreaks. Because these 2 ended up being where the first cholera cases following Kenneth were observed. So this model was one that we did prior to Cyclone Kenneth occurring. And then after Kenneth occurred and cholera cases were identified, we wanted to update the model to respond to the ongoing information and data that were coming in. So we updated the web-based tool so that users could input the number of reported cholera cases in each district. And then the model would update to update the risk of areas around those places. This is incorporating the gravity model that I mentioned before, thinking that areas that are more highly connected to areas with cholera are more likely to be at risk of cholera cases. So we allow the model to be dynamic, but still just looking at those 4 risk factors and weighting them equally and trying to keep it simple, but give a list of priority districts that we thought were most at risk. So just to talk about some of our results. So our simple model and our interdisciplinary team allowed for constant communication and rapid updates to the model as new information became available. Every couple of days, we were tweaking the model, adding in more data that became available, and trying to learn what would be most useful to the people making the decisions about the vaccination programs. And as I showed, the model prior to Kenneth's arrival that used previous incidents, projected flooding, and El Nino sensitivity accurately predicted areas at highest risk for cholera. So that was promising that our model seemed to be working decently well. But one challenge that we faced was that not all data were available at the scale at which the vaccination campaign took place, limiting the model's utility. So as I showed you in the previous slides, we were looking at the district level, but the vaccination programs were being decided at one administrative level below that. And one of the rate limiting steps was actually just finding shape files at the administrative level that we wanted. This limited our ability to make the model as useful as possible. However, the data inputs that we did have ended up being useful to the Ministry of Health in addition to the model itself. So for example, the admin level 5 population data ended up being incorporated into their response planning. I think there was data sharing and utility that came from this collaboration beyond just the model itself. So there are a number of lessons learned from this experience, and Andrew mentioned crisis ready and kind of the 3 pillars of readiness. So in terms of data readiness, as I mentioned, our access to the relevant data, spatial data, flood models, population data was incomplete at best. We ended up incorporating a lot of different data sources, but it was just sort of what we could get our hands on at the time. So this led us to think, how can we in the future better aggregate sources of data in advance? And we thought about the data sources in kind of 2 different ways. There's one data source one set of data that can be aggregated ahead of time, population data, other data that's less related to the specific disaster or crisis. And so there are ways to aggregate those and make those available in a more systematic way. And then of course there's data related to disasters, flooding data, color case data, things like that are going to be collected after the disaster hits, but are there ways that we can kind of streamline collection and sharing of those data? Then there's methods readiness. So we really focused on having a minimum viable model. We wanted a simple model because we had limited time. So it was important to rapidly assess the risk. And we also wanted to ease communication in the midst of a disaster. We didn't want to develop a model that was so complicated that it took a really long time to understand what we were doing. We wanted it to be a minimum viable model to communicate where we thought risk was greatest. So this led us to think, how can we ensure that we have these kind of models ready to go at the outset of a crisis? Each disease will have different parameters that will make the model somewhat unique, but there are some kind of basic things that can be developed in advance that can be sort of more easily adjusted as more specific information comes in. And then translational readiness. Throughout this whole process, our partnerships with the Ministry of Health and with the World Health Organization were really key for informing our model and for us to try to make sure that our model was actually going to be useful for the response. So this led us to think, what kind of translational engagements could we engage in earlier to make sure that they're already involved in these efforts, and how can we ensure this communication is an ongoing process and that everyone is sort of able to respond as quickly as possible and ensure the results of these models are as useful as possible. So with that, I just want to acknowledge all of the collaborators on this project, and then we've written up more details of what I just talked about in this paper in pre-hospital and disaster medicine. I just want to thank you all for listening, and I look forward to the discussion later. Thank you.
Perfect. Thank you, Rebecca. All right, I'd like to bring up my colleague, Erin Huey, who heads up the work of the Pacific Disaster Center.
So aloha. Let me know if you can't see my screen. So aloha, everyone. I'm really happy to be here and to talk to you a little bit about how we're currently using a variety of models operationally to support response around the world, with a focus on the Bahamas. But as Andrew mentioned, 2019 seems like a very long time ago. So for those of you that are not familiar with PDC, our entire goal is to take the best science, the best technology, and get it into the hands of decision makers, which means there's a distinct balance between having being accurate and accuracy and precision. And many times we need something accurate and we need it fast, but can live without the detailed precision. But our whole focus is to reduce disaster risk and ensure that we can make some of those critical life-saving decisions. Just a little background, if you're not familiar with us, we've been around for almost 25 years now, and it says 6 global locations, but we're actually at 10 global locations now, and we cover all hazards worldwide. Our focus is always bringing in that data so it really pairs nicely with what Rebecca was talking about with data readiness. So our focus has been to bring in a variety of data sources, standardize those so that we can then embed them, leverage them, and combine them with advanced modeling capability for the sole purpose of providing actionable risk intelligence. So if you can't make a decision off of it, if it's not advancing, then we move past that and leave that to other groups. But our focus is specifically for advancing that decision making. And I'm going to give you some examples of how that's been done. And then we also get asked, well, how do you have so much data? Where are you working? And, I tried to provide a little bit of an overview here of some of our partners around the world and why we're able to leverage these models in a way that impacts localized decision support. I'm going to start first by talking about the data piece. So to have good models and to leverage those for response, you have to have started with a foundation of understanding and data at a detailed level. And so for the last 5 years, we've been working on a program called the Baseline Assessment, where we're working with countries worldwide to gather not only data on risk and vulnerability assessments and hazard exposure, but I think also the importance of the existing disaster management structure, because that's going to lend context to your models and lend context to your decision making as events start to unfold. And then working with our partners for this data exchange and information exchange. And I think as we look at emergency managers and we look at understanding risk, I think a core component of that is it needs to be a fluid sharing of data and updated data in formats that are useful and easy to access. So what we've done is, as part of our efforts, is we're drawing on that baseline data that we've collected worldwide and advanced modeling capabilities, and then joining forces really with the people who have the mission for supporting global response. So here, for example, what you're looking at are a series of real-time model outputs that we've used. The first one here in the front is what's called a JADE product, and that's our Joint Analysis for Disaster Exposure. And that's done in combination with the World Food Program and UN OCHA. But you'll notice that the information is very actionable, right? So we're talking about how many people are exposed, who it has extreme exposure, and of those in extreme exposure, who has extreme vulnerabilities or poverty. And if we have to prioritize resources, what resources go where? So on the bottom, it's a little hard to see, but specifically which departments, provinces, municipalities, and how much food, water, and shelter are being moved into those areas. And this can be updated with every single advisory. So as the situation unfolds, so can the information. The other point that I want to bring out here in the background is also our partnership with with ASEAN and the ASEAN AHA Center, and working with their emergency response teams, their ERAT teams, to be able to have the right information going into country and to support their partners. But the core takeaway here is that these detailed subnational breakdowns and the understanding of the models are a combination of partnership with global partners, academic institutions who specialize in the models themselves, and then PDC's capability to bring that all together with our all hazard impact models. I know the focus was on Dorian, and the Bahamas is near and dear to my heart. I've worked with them for the last 20 some years to build their capacity. But when we started talking about real-time models, I think the piece that I wanted to really share with the community here is that it's these non-traditional approaches that we need to continue to invest in, and believe in, because the individuals impacted are our best sensors. So what you're looking at here are information from Facebook's Data for Good that's coming in related to the movement of people, and a core decision that was made and identified as a result of that specific data and modeling it against what PDC already knew about the impacts was that we had a group of individuals that was on an outer island that we were unaware of, and that no service or products were being provided to in Eleuthera. So by having this real-time data, combining it with PDC's models, we were actually able to make some of those real life-saving decisions to advance response efforts. There's a lot going on this year, but I did want to make sure that we identified a few other uses of real-time models for response operations. And so I'm sure many of you have been paying attention to ETA and IOTA as it went through Central America. And here what you're looking at are a couple examples. This is real-time modeling of dam exposures and the population, number of housing, what the built environment looks like, specifically so that they can support evacuations in those areas. And we were doing those real-time as new data came on the status of the dams and water levels. We're also able to provide similar information for landslides. And so we were doing that because I think we often forget that most disasters have secondary and tertiary impacts, and we need to be able to quickly analyze and determine for all hazards, what's happening, where is it happening, who needs support, and what do I do? And I think that's the key for effective real-time modeling for disaster responses, answering those 4 questions. And then before I turn over my time, I did want to just also note the efforts that are going on for real-time COVID analysis and exposure, not only globally, but also nationally here in the US. We're supporting all 54 states and territories as we look at the changing dynamics. We're also leveraging that subnational data, the detailed data, for countries around the world to help determine what priority actions need to take place. And we're doing that in areas even of conflict here in Afghanistan as an example. So with that, I will just say thank you and mahalo for your time. I appreciate the partnership for those that have worked with us, and look forward to the other presentation.
Okay, perfect. Thank you so much, Erin. That was great. Our last speaker is Alex Pompey from Facebook Data for Good. So Alex, take it away.
There's the mute button. Can everyone hear and see my slides? I'll assume so. Alert me if not. Yeah, so Facebook's Data for Good program. Our job is to find data sets that are available either in Facebook or from publicly available data sources, and make them available to humanitarian response efforts, NGOs or academic researchers like our previous speakers, and to make sure that those data sets have the necessary privacy protections to ensure user safety. So it might be atypical for a discussion of modeling for Facebook not to be doing modeling. There's a lot of groups at Facebook that spend all of their time on that, but we're really just a data out shop. So nothing that I'm talking about today is explicitly modeled estimates for but it's meant to be inputs to those types of models for the types of disaster response scenarios that we'll walk through. So first, I'll just share and recap the type of data that we sent out for the cyclones in Mozambique in 2019. You've seen a couple pictures like this already. What we do is look at a comparison of the number of Facebook users who share location data with Facebook. That's an opt-in feature. It's not on by default. And compare those just counts of users over grid cells or administrative polygons compared to pre-crisis levels. So you're seeing where population is increased in blue, and where it's decreased in red, looking at the number of standard deviations as a z-score. What you'll notice for the data in the affected region of Mozambique is that it's quite sparse. There's very minimal Facebook penetration across Mozambique, especially the central and northern regions, and especially those users that are opting in to sharing location data. This is even more sparse because this tends to require a newer phone so that it doesn't drain battery at a level that's unacceptable for a user experience. So fewer people in these relatively lower socioeconomic status groups would have availability of that phone. And so this really would limit our ability to provide actionable data in this particular instance. You see that it's mainly that there's data available in the Pemba region, which is the largest population center. The data is updated every 8 hours. It's automatically generated any time that there's a safety check on the Facebook platform. The trigger for safety checks at the initial stages, like CAP alerts or other alert services from a myriad of sources that go through a filtering process. We also can look at the patterns of data packet performance between our data centers and people and our users' mobile phones across 2G, 3G, and 4G bands. So this is the 3G coverage, and we can compare those packet performance signals to pre-crisis levels. So sometimes this there's kind of two main effects that can happen to this infrastructure during a crisis response. One is that the natural disaster knocks out infrastructure, destroys cell towers or electricity infrastructure, and we can see the effects of that and share that with NGO and researchers who are responding to the crisis. The other effect is that large population shifts can overwhelm networks that weren't designed for an influx of people. And also in crisis settings, people tend to use Facebook and other communication tools at a much higher rate because they might be in new places, they might be trying to connect with friends and family to offer assistance or to seek shelter. And so when this usage spikes, it can overwhelm the network, and we can see those effects in our data signals as well. Now shifting over to the Bahamas, I think you've actually saw this exact same picture from a previous from the previous speaker, so I won't explain it again. But similarly here, the network effects, we saw a big change in a lot of network connectivity dynamic situations as cell towers were being put on backup power from diesel generators. These generators might, they usually scale back the broadcast range, or even they might turn off 4G and shift just to 3G. So all of this is a pretty dynamic situation, and it's really important, especially for our partner NetHope, or when the UN's emergency telecommunication cluster is activated, as it was for this crisis. So again, we're just one piece of the puzzle. Facebook user penetration is not uniform. It was, and so we, publish transparently the privacy protections that we put into these data sets to encourage other private sector companies to offer their slice of the puzzle and make available as well during times of crisis. And so here, sorry, just to recap, this was the baseline connectivity on 3G, and then here is the connectivity shrinkage as the crisis hit. So a pronounced retraction in the overall coverage around the affected area. And as was described earlier, we also can look at the trends of population movements. We make those available, and they've been used, probably one of the most popular data sets for modelers. So in affected areas, or even adjacent to affected areas, we see population changes. So here, arrows that are red, the more red and the larger the arrow, the larger number of Facebook users moving from point A to point B, or in this case, it's county A to county B, compared to pre-crisis levels. And so this is even before a storm is hitting. If there's advanced warning, people are able to assess operationally the extent of evacuation orders and how far people might be going down a road. and then monitor this in real time as the data sets, or close to real time, as the data sets are updated every 8 hours. So if any of those data sets sound useful to you for your response, your modeling efforts, or just your simple like observation operations, they're available. You can contact us through our website at dataforgood.fb.com. But I wanted to focus on, if these crises had happened now, what new data sets do we have available that were specifically designed to be useful for modeling efforts? So let's fast forward in time and imagine what the new possibilities might be. So the first thing would be that our network coverage, the cellular network coverage maps shown here for the Bahamas, we have created a much simpler version. So if you simply just need to answer the operational question of where do we have are we confident that there is network coverage, and where are we confident that there's no network coverage, we create binary maps just to simplify what's a pretty complex data set. On the modeling front, what we hope is a very useful covariate is called our social connectedness index. This was accelerated work to release this publicly for COVID-19 purposes, but there's a strong possibility of applications to disaster response modeling as well, in terms of potentially predicting displacement amounts and the destination of displaced populations. So the social connectedness index is actually pretty simple to construct. If you look at a region, it can be a country, a county, a state, or at any administrative boundary, and you add up the total number of friendship ties on Facebook of all users between any two of those region pairs. So let's say the two countries on Earth with the largest number of Facebook friends get a score of 1 billion, and the two country pairs on Earth that have the smallest number of total friendship ties get a score of 1. And then every other pairing of countries gets a score in between those. That is the social connectedness index. There's some noise added in there and some sampling according to a differential privacy framework to protect user privacy. But really, it's then a score that would be akin to a relative likelihood or probability of friendship based on what we see in the friendship graph on Facebook, but now geospatially oriented. So any two regions on Earth, you can have this social connectedness score. Here we're looking at the social connectedness index for Mozambique, and we see some probably mostly colonial reasons for particular likelihood of Facebook friendship ties between different countries. So this has been useful. It was originally developed for understanding the direction and implications of economic shock when one region is affected by a crisis or a change in economic stability, and how that radiates outward to other places. But it's been found useful for even more direct crisis response applications, such as displacement. And we can look at this in a much more fine-grained and even more distant level. Maybe this would be useful for predicting and organizing fundraising efforts to reach populations or family that are based abroad. So this is the social connectedness index at a county level to Mozambique. And so this would be probably a high probability of a diaspora populations, and many of these are strongly motivated for fundraising and giving campaigns when family members or historic ties are activated by a natural crisis. We can look at the country social connectedness index for the Bahamas, and these again probably aren't super surprising, but might be very useful for understanding how people might tend to react, or since many of these same areas are affected by the same types of crises year over year. So if we were trying to understand, hey, if we looked at a cyclone or a hurricane heading towards Jamaica or Haiti, what are some of the past examples that we could look at, maybe the Bahamas, and how movement or how the people's reactions unfolded might be indicative, since it's been shown that social connectedness index is a strong predictor of how people will respond to policy interventions such as social distancing, mask wearing, mandates when studied across the United States and other countries. It'd be interesting to continue expanding that methodology to a more applied disaster response scenario. And again, just to extrapolate the granularity that the social connectedness index can be produced at, we can look at specifically a sub-county region connections to the Bahamas. Again, we probably see a lot of historical family and diaspora reasons for causing these probability of friendships. But again, really interesting to consider this as a potential covariate for how diseases might spread. It's been shown to be useful for COVID-19 predictions. So initial hotspots in the United States, in upstate New York and in Italy, the COVID-19 disease rates moved rapidly to areas that had strong social connectedness indexes to those initial hotspots of cases. And lastly, we've developed methodology to target surveys on Facebook. These are usually not done during the time of crisis, since people are really kind of struggling with immediate, but maybe months after a crisis, we can surface surveys, either related to the nature of their displacement, asking them if they received an alert from a local authority, who in the family made a decision to return home, what data sources do they use to make that decision. So these targeted survey opportunities we've deployed in Australia at the end of 2019 to ask questions related to face mask usage in response to those wildfires. And we hope to roll this out as a global program in the coming months. So we're excited for that kind of survey data to be used initially as a validation layer, but then ideally to inform modeling efforts as well in the future. So that's it from me. I'll turn it back over to Andrew to lead the discussion.
All right, perfect. Thanks so much, Alex. And actually, as a first point of discussion, I wanted to give an opportunity to our colleague Nick Jones from GFDRR to jump in maybe and say a few words about how they're thinking about some of these same issues, in particular this issue as I think every one of the speakers talked through, the kind of new opportunity for integrating real-time signals around human mobility into disaster planning, risk assessment, and then modeling that would be in the response time frame relevant to operations. So Nick, did you want to quickly jump in on that?
Yeah, thank you so much, Andrew. Thank you to all of the speakers for tremendously insightful presentations. Essentially, we're dealing with some really novel types of data which are also becoming increasingly democratized, which is why the space of utilizing real-time data to improve our natural disaster responses is so dynamic and interesting at the moment. And if I may, Andrew, just show one slide. We have a small schematic here, which is trying to illustrate the relevance of newer forms of mobility data, such as the mobility data from Facebook, from ad tech firms, or Google and other sources across the disaster management cycle. And really we're seeing a number of quite scalable and replicable use cases which are relevant to many different countries, both in the emergency response phase, but also to understand maybe in a 3-month or 6-month time frame after an event, which areas are recovering quickly, which areas are lagging behind, and to inform ex-ante risk assessment. We have been really just focusing in our recent discussions with the partners on this call on the question of how do we scale up the utilization, really promote uptake among the wider community of this type of policy insight. I think Erin and Rebecca showed some fantastic proof of concepts, but eventually my feeling is that realizing the potential impacts from this data is going to require uptake in the wider community. So I just wanted to leave you with a couple of the key challenges that we've been thinking, throw this back to people on this call. Working with Facebook data opens up a couple of common challenges that many people are grappling with at present. Facebook users are more usually in the high income segment of the population. They tend to skew towards male. Validating the estimates of population displacement is really important. And among the, what I would call the stakeholder challenges, to get these policy insights translating into action, we really need to build the end user confidence, right? We need to be able to ensure that when insights derived from these new data sources are presented to the director, within, who's handling a reconstruction program or who's handling an emergency response for a particular government or local authority, we need them to be able to trust what they're seeing. As a challenge for our community in the next year or two, the way I would see it is we really need a concerted effort to address some of these methods challenges and to demonstrate how we could scale those use cases and how people can make robust decisions based on them. We've had some discussions on crisis ready and on opportunities to develop some type of a stakeholder network to engage the relevant people around this table. Really be interested in the thoughts of people on this call on that topic. Thank you.
All right, that's great. So in the interest of kind of going back to this question of how we kind of move the conversation forward and where we kind of get increasingly into like operational frameworks, I wanted to maybe go back to Rebecca. And Rebecca, if you wanted to think about if Cyclone Kenneth happened today, or if we were to try to re-implement the kind of partnership that we were doing back in 2019. I mean, what do you think are kind of the key pieces that you'd want to see in place at this point in order to actually, do a somewhat better job this time? Where would you kind of want to focus people on?
Yeah, I think that's a good question. I mean, I think the other presentations showed just sort of, even in the past year, I think there's been a large effort to try to, collect data sources and aggregate them into more centralized places. So I think sort of having a little bit more of the sort of baseline information about these locations and also improved movement data, I think has just been remarkable progress even in the past year. And I think COVID has, of course, kind of spurred a lot of that. But I think it was sort of, because it was the, crisis situation, we were developed the team pretty quickly. I think maybe if we'd been able to kind of have some like more conversations with the whole team, I think that would be useful too, to kind of sort of, even in the midst of a disaster, just try to get everyone on the same page to make sure everyone knows what would be most useful. But yeah, I think there's been a lot of progress in terms of, aggregating data sources, and in terms of the data readiness. I think there's been progress in sort of the methods readiness as well. And I think just sort of trying to get that translational readiness piece and just sort of making sure the right stakeholders are at the table, thinking through, who should be involved. We've talked about doing some, simulations of crisis scenarios to kind of work through some of these issues. And I think that could be really helpful in the future to prepare for future disaster response.
Yeah, absolutely. I think it's an open call too to think. Maybe this goes to Nick's point as well around ways to build on some of this work as to how do we actually practice real-time risk modeling before emergencies happen as part of our kind of preparedness effort. We had a few conversations towards that end, but I think there's some opportunities really across sectors to be able to do that more effectively in the future. It might be an interesting role for the kind of stakeholder network that Nick was describing. And maybe to you, Aaron, as we think about the range of models, and you outlined a huge set of data inputs that come into PDC and to the kinds of outputs that you're producing. You know, what are some of the opportunities that you see there for, first of all, incorporating disease risk into how you guys are working, and then second, for you know, the kinds of stakeholder networks and maybe practicing, you know, simulation exercise beforehand? How have you guys thought about where that kind of shakes out in terms of preparedness in the future?
Thanks for that. I think first on the integration of real-time models into the preparedness, we've actively been doing that for exercises over the last 24 months. So as soon as we got our initial model for all hazards impact, what you saw in the JADE, functioning and operational, we started to weave it into the preparedness so that responders knew to ask for it and they knew to request that type of data and that it would be available to them. So we've worked very closely with state, local, federal partners, but also on the international exercise kind of circuit. So with our partners with UN-OCHA and our partners with ASEAN, as well as the US Department of Defense. And our main focus on that is to ensure that if we're producing models that have exposure data that people will plan to during a real response, that we're all using the same data and same information. So we've been you know, tying this into your second piece, which was the network. I think what Nick and Rebecca and others were talking about is absolutely critical for the success of disaster management. I think often, you know, every agency or organization wants to highlight their contribution, and their contributions are important, but it is the collective contribution that is required for full success. And we need to realize that this is such a complex issue that partnerships, we say this all the time, right? Don't share your cards during a response event. This session here today is important for people to get connected, to have awareness, and to engage. And I think openness of data sharing. So we really have to continue to break down the barriers. And when we do have barriers to data sharing, one thing that we've been working on is working with our partners to create their derived products forum. Because we do have, you know, Rebecca talked about the scale of the data. We do have very detailed data in many countries coming from the country, but we are not allowed to redistribute that data. But if we understand what the requirement is, we can produce the product and get the data and information. So I think the partnership is really important. And then just finally, we have been integrating, since the 2015 Ebola crisis, been integrating health-related data into our models, and that's continuing to expand both as a primary hazard and as a secondary and tertiary hazard.
Excellent. We are close to time. There are two questions that came in through the chat that I just wanted to call attention to, and maybe toss them back out if there are quick responses. One is around local actors. So we've talked a lot so far about international organizations, national government, et cetera, but can anyone, does anyone want to take up, and that would include you, Alex, talking about the kinds of partnerships that can be advanced through some of these data sharing agreements. And the second is around legal limitations in Africa for data in disaster assessments and analysis, which we may go beyond the time limit to take up. So, but would anyone like to take up either of those, particularly this question around making sure that local actors are engaged in this kind of modeling?
So I'm happy to jump in on the local actor piece, because that is our main focus. And I mentioned the baseline assessment programs, but those are specifically designed to work with local disaster managers at a subnational level. So we're not talking about going to the country, we're actually the subnational level to help support data and give the data back, analyze the data, and they become core stakeholders. And so for example, with IOTA, through our partnerships in Nicaragua, Honduras, and Guatemala, it was the local emergency managers that were reaching out to PDC to leverage that data. And these partnerships are also critical because understanding the local needs and partnering with them on data, when an event happens, they do not have a robust enough system to have backup for their data. So we have integrated and serve as their primary backup. so that that can be used. But I don't think we can underestimate the importance of that localized partnership, and that is a main focus.
For sure, and just one other way to think about it, kind of tying back into the stakeholder network idea, is around making sure that we're doing capacity building with local actors well in advance. So I think, you know, making sure that universities in areas that are highly disaster affected are included within training programs around this kind of data, and we develop international academic partnerships to help kind of move that forward. That there's integration at multiple levels of emergency management, like you were suggesting, Erin, multiple levels of public health. Those kinds of deliberate incorporations of multi-scale partnership can be, I think, extremely effective by the time you get down to actually having to respond to an event and make sure those networks are in place. I think we are at time here, unless there are any final thoughts that folks would like to close with. Otherwise, I'd like to just thank everyone for joining and for all the panelists for really excellent presentations. And Erin for being up so early from Hawaii. Really appreciate it. Please, everyone, feel free to follow up, reach out. I think we can stay in touch through understanding risk. And so I'm happy to follow up any of these conversations in the future. Thanks, everyone.